Hi, I'm Henry Cusnir. I'm an interventional cardiology with HCF Florida Broward Cardiology Plantation. I perform procedures and I also see patients at the clinic. And we're a pretty busy practice. So when I did my rotations through medicine, I realized that cardiovascular was a really nice field. And I was very good with my hands. I was well known for almost being able to do anything with my hands. So when I was given the opportunity of becoming a cardiovascular doctor, then I took it and the rest is history. We treat a lot of conditions. We go from clinical cardiology, where people just require some medication to improve their condition or improve their quality of life, to complex procedures where we actually open up arteries to prevent chest pain, prevent angina. We also do now newer procedures, which are TAVR, where we put valves in people through the groin, which is significantly less morbidity and mortality than in the past. And now it's even approved for low risk patients. I usually try to find a little bit about them before I get started. I always ask the patients, where are you from? What background do you have? What's your family history? And then we usually get into the symptoms or their condition. Because it changes the perspective of what I'm dealing with. And I really like to know a little more about my patients than just the condition and the medicine. On most of my patients, I usually remember what they do for a living, or if they have any family member that I know, or any family member that has been treated by any one of us. And that actually helps a lot. Our practice is unique. And our practice is, we treat all sort of patients. I can say that our practice is completely bilingual. Everybody in the practice speaks perfect Spanish, including my associate, Dr. Giddis. And that actually is really helpful for the patients, because a lot of the people that we're seeing now in Broward, which used to be just Miami, are Hispanic. And we can provide excellent care for them because we speak their language.